Police in Tameside in Greater Manchester are investigating the deaths of 20 people who are all patients of the same GP. The GP involved in the inquiry is Dr. Harold Shipman, who has practiced in this surgery in Hyde for more than 20 years.
Hey everyone, good morning, good afternoon, and good evening. Welcome back to our channel. This is the Crime Time Tales News, and today we're going to look into one of the most notorious serial killers from the United Kingdom, and no other than Harold Shipman. Harold Shipman, also known as Dr. Death, was a British doctor who became one of the most prolific serial killers in recorded history. He was convicted of killing at least 15 patients, primarily elderly women, although the actual number of his victims is suspected to be much higher. This tragic story of medical malpractice and murder unfolded over several decades, shocking the nation and raising significant questions about the healthcare system and patient safety. Okay, let's dig into Dr. Shipman's early life and medical career, shall we? Harold Frederick Shipman was born on January 14, 1946, in Nottingham, England. He grew up in a working-class family, and his upbringing appeared to be relatively ordinary. Shipman's interest in medicine developed early on, and he pursued his passion by attending Leeds School of Medicine in 1965. After graduating in 1970, he worked at various hospitals in the region before eventually setting up his own practice in Hyde, a town near Manchester. During his early medical career, Shipman began to display troubling behaviors and character traits that would later become red flags for his heinous crimes. Colleagues and patients described him as cold, aloof, and lacking in empathy. He often displayed a superior attitude, refusing to consult or collaborate with other doctors. Shipman's demeanor and behavior made him an outcast among his peers, but his patients, particularly elderly women, were initially unaware of the danger they were in. Let's look into his killings and modus operandi. Harold Shipman's killing spree began in the mid-1970s and continued for more than 2 decades. He targeted his victims within the confines of his medical practice, taking advantage of their trust and vulnerability. Shipman primarily selected elderly female patients who were in relatively good health, but had limited social connections or family support. His preferred method of killing was through the administration of lethal doses of drugs, particularly diamorphine, a powerful painkiller also known as heroin. Shipman manipulated medical records and forged documents to make it appear as though his patients had died from natural causes. By doing so, he successfully evaded suspicion and scrutiny from authorities for a significant period. Shipman's modus operandi often involved visiting patients' homes to administer lethal injections, claiming they needed pain relief or medication. He deliberately targeted victims who lived alone, ensuring there were no witnesses to his crimes. Shipman's calculated approach allowed him to maintain a facade of trust and reliability among his patients, who regarded him as a caring and competent doctor. Finally, Dr. Shipman was investigated and arrested, about time if you ask me. Despite Shipman's prolonged killing spree, it wasn't until 1998 that his crimes were finally brought to light. His downfall began with the death of Kathleen Grundy.
There are reports that Mrs. Grundy's daughter was concerned when Mrs. Grundy apparently changed her will unexpectedly and quite late on.
Police say that it will be another 2 weeks before they have the results of the forensic tests on Kathleen Grundy. They say until they have those results, they will not be interviewing Dr. Shipman.
An 81-year-old former mayor of Hyde. Shipman had falsified her will to include himself as the beneficiary, arousing suspicion among Grundy's family. They alerted the authorities, leading to an investigation and subsequent exhumation of Grundy's body. Post-mortem examinations revealed an abnormally high level of diamorphine in Grundy's system, prompting a deeper investigation into Shipman's practices. Detectives began to unravel a horrifying pattern of suspicious deaths associated with the doctor. The sheer volume of evidence amassed against Shipman was staggering, and it became apparent that his crimes were far more extensive than initially suspected. Okay, let's look into the trial and conviction. Harold Shipman's trial began on October 5, 1999, at Preston Crown Court. The prosecution presented a compelling case built upon the meticulous examination of medical records, expert testimony, and the testimonies of surviving family members. Shipman vehemently denied the charges, claiming innocence and arguing that his actions were medically justified. The trial painted a chilling picture of Shipman's actions and mindset. Witnesses described his cold and callous demeanor when informing them of their loved ones' deaths. In 2000, he was found guilty of 15 counts of murder and sentenced to life imprisonment. Shipman later took his own life in prison in 2004. Anyway, guys, what are your thoughts on this case? How comes other doctors couldn't tell something was off and report the issue? More than 15 killings? Surely someone would have suspected something, right? Anyways, leave your comments below. And don't forget to like, share, and subscribe to our channel. Look after yourself and one another.